Hi parents, I'm Dr. Shivani Deswal. I'm a pediatric gastroenterologist at Gurgaon. Today I'm going to talk about a very common complaint with which parents come to me, that is vomiting. Vomiting is involuntary, forceful expulsion of food from the stomach. Whenever a child comes to us with vomitings, we try to differentiate whether the vomiting is because of a GI cause or it is because of a non-GI cause. In babies and toddlers, non-GI causes are also important causes of vomiting. A child could be having an ear infection, a child could be having a chest infection, a child could be having a urine infection, or a child could be sometimes rarely having brain infection and having irritability and headache along with vomitings. Once we are sure that the child is having a non-GI cause, we try to focus on GI cause. Now again, GI causes we usually divide into surgical causes and non-surgical causes. So in surgical causes, a baby may be having an obstruction at the end of the stomach, or baby may be having, intestines going into each other, which we call intussusception, or sometimes an subacute intestinal obstruction because of chronic constipation and severe constipation. Sometimes children have appendicitis, which can cause pain abdomen along with vomitings. So these are the surgical causes that we commonly try to rule out by our examination and our history. And they are very important clues, like if a child has a lump in the abdomen, or if a child has a right severe pain, right abdominal pain, then we suspect appendicitis in such children. Sometimes even pancreatitis can cause epigastric pain or a diffuse abdominal pain with a lot of vomitings in children. So these are causes which are very important and emergency. The other causes are, sometimes a child has peptic ulcer disease, or as what we call severe gastritis because of H. pylori, or because of taking multiple painkillers, and the child presents to us with pain epigastrium or chest pain along with vomitings. Sometimes the child has a reflux disease, and the child either has a eosinophilic esophagitis or a food allergy, and that presents as a reflux, and the child has persistent vomitings with failure to thrive. And another very common cause in children vomit is stomach flu. The child suddenly catches a fever along with pain abdomen, loose motions and vomitings, which usually lasts for 2 to 3 days, and the child gets better. It could be because of a bacterial cause or a viral cause. So whenever your child has vomitings and which are persistent, having at least 4 or 5 vomitings, not controlled by one dose of an antiemetic, and the child is having other features like irritability or lethargy or pain in the abdomen or a lump in the abdomen, or has not passed stools, or child has an earache, it is very important not to ignore vomiting, and you must consult your pediatric gastroenterologist immediately. The doctor, depending upon the entire history and the clinical examination of the child, usually advises very minimal investigations to pick up the exact cause and advises treatment accordingly. But warning signs of vomiting should not be ignored. A very important thing that parents should ensure at home is that the child should remain hydrated. Okay, the cause of vomiting may not be that severe, but the complications of vomiting can be severe. Your child can get dehydrated, your child can have a fluid imbalance in the body, electrolyte imbalance, a child can get lethargic because of that, your child can have a decreased urine output because of persistent vomitings. So fluid is very important in vomiting. Make sure that you give an antiemetic to your child. After that, wait for 30 minutes. Then try to feed your child with fluid. It should usually be a plain water or ORS or coconut water or buttermilk. Do not try to give high sugar drinks or juices to your child. Do not try to give him biscuits and high salty foods or milk to your child. They can aggravate the vomitings in your child. So make sure your child is passing urine frequently. Make sure your child is drinking fluids. If the child is not, immediately rush to the emergency, and also consult your pediatric gastroenterologist so that he or she can pick up the cause immediately and give your child relief.